I hope that we're bringing national attention to this issue for nursing. As I flew in last night, I thought about the flight attendant on the plane and how protected they are from a federal level. And it worries me that we don't protect nurses who are already dealing with some of the most difficult times in a patient or family member's life. We should have the same kind of protections.
Hey everyone, this is Jonathan Marx from GoToHealth. If you're a fan of the show The Pit, you saw instances of workplace violence this past season, but that's a TV show. What's happening in real life? Let's talk about that. Data reveals the escalating safety risk nurses face on the job. The American Hospital Association estimates that up to 76% of healthcare workers, 3/4, have reported experiencing violence, both verbally and physically. New findings from Axon, a leader in public safety technology, show that 8 in 10 healthcare leaders report operational disruption from safety and security challenges in the past year. These issues affect staffing and costs, including employee turnover, insurance expenses, and recruitment needs. Security technology is viewed as a key solution, with more than half of healthcare leaders favoring greater investment in de-escalation training, real-time monitoring, and body-worn cameras for frontline staff. We're talking today with John Voight, Vice President and Chief Nursing Officer at Memorial Hermann the Woodlands Medical Center. He's a U.S. Army veteran and former law enforcement professional. He's a recognized leader in workplace violence prevention. We're also talking today with Mike Schur, the Senior Vice President and General Manager of the Enterprise Division at Axon, where he leads the company's outreach into non-public safety sectors such as healthcare, retail, logistics, and manufacturing. He's guided the expansion of Axon's safety ecosystem beyond its law enforcement roots to protect frontline workers and healthcare environments. So welcome to the show, John Voight and Mike Schur. How are you both today?
Doing great.
Morning.
Good. So if you're a fan, and I'm talking to our audience, if you're a fan of the show The Pit, we all got exposed to workplace violence this past season, but that's a TV show. So my question for you guys is, what are healthcare leaders really dealing with when it comes to safety and security in healthcare settings?
Well, I think that The Pit did a great job of showcasing workplace violence in an emergency room. My background is emergency and trauma nursing. And so I have experienced that in an emergency room environment. I think that, because of that show, I think bringing that to the forefront and the national attention is helpful. I would say that, workplace violence has become a huge issue, the number one issue of burnout for nurses in our country. And I think that, if you look at the stats, it certainly supports that a nurse is assaulted every 2 hours in this country.
Wow.
Those are stats that most people don't know about. Post-COVID, it has gotten much worse. I think in 2019, there were 14,000 assaults reported on nurses. And in 2023, that number has jumped to 24,000. Not only has the number increased, but the egregiousness of the assault has gotten worse as well. So I think that's the number one thing we're trying to manage.
Got it. So who's doing these assaults? Are these patients? Are these people with mental problems? I mean, what's going on here?
Yeah, I think it's a loaded question. I think that it's all the above. It's patients, but I think honestly, nurses expect patients that are physiologically ill and have symptoms of behavior inappropriateness. I think about, traumatic brain injury patients. That's something we expect, and we predict that. We manage those situations. I think it's the unexpected that makes it worse. It's the visitors that come in that get, belligerent or physical. That's what we don't expect. Women's services, as an example, in labor and delivery. The dysfunctional families that exist out in the community come into the hospital, and those have the potential to escalate as well. So it's a multitude of issues, and of course the mentally ill is a huge issue for us in healthcare. I think that the availability of resources for that particular patient segment are limited, and I think that results in those particular patients decompensating and coming into the hospital for emergent psychiatric care as well. So it's all of the above, but certainly there's certain areas that we can have more opportunities for stopping those.
Thank you for sharing that. Mike, can you tell us What is Axon and how can technology support safety for nurses and other healthcare workers?
Sure. And I think John's done a good job to sort of talk about the pervasiveness of this challenge. And, Axon comes in on the safety and security side. Our mission as a company is to protect life. And we really got into healthcare in 2020, was COVID really, you saw this uptick in violence in the hospital system. And some of our solutions started to get adopted by the security personnel in hospitals. And so now over 50% of the top 100 hospital systems are using some of our solutions, such as body-worn cameras, evidence.com, our digital evidence manager, or Fusus, our real-time operations software. And so what that looks like in practice is something like a panic button being used a body-worn camera being used as a panic button. And now you've got a real-time audio, real-time video, a documentation of the event, and post-event, the reporting and investigation side. That can actually take hours. In large part is why actually these incidents are underreported. And so by becoming a lot more efficient from before event, real-time during the event, and after the event, you're actually giving these nurses a chance to be protected, to be secured, and for them to feel enabled and empowered in their day-to-day work. There's 4 million nurses in the US. It's pretty shocking what's become normalized. It's 5 times more likely to experience a workplace violence incident than other jobs. And so this is really taking back some of that, perspective and control and real-time transparency of what's occurring for these nurses.
So I think you bring up an important point. We're kind of used to, I think, seeing law enforcement or police wearing body cameras. But what you're telling me now, Mike, is that nurses and doctors are starting to wear the same kind of equipment to record what's going on.
Yeah, that's exactly right. And I don't think we have time today to talk about all of how that occurs. I'm sure there's questions around, call it policy or compliance or clinical care. You're really starting to adopt this in places that are the most violent. You talk about the emergency room. You talk about the receptionist at the employee when folks check in. When you look at, call it the surgeries or clinical care perspectives, there's early sort of adoption in that segment. We're super excited about what we're seeing, but the reality is that technology exists nowadays to perform this in a compliant, HIPAA compliant way that protects patient privacy. And so, not only is that a camera for audio and video, but you also have workflows, things like automated report writing, or actually an assistant on your chest that can give you best practices. And so the power of AI packaged in a small wearable is actually able to bring some of these technologies that already exist around the hospital system, your CCTV in the ceiling, your panic button on a nurse, your EHR system that you've got to log into 4 times. Actually, technology allows you to make all of that simpler so nurses can focus on providing care and doing clinical work versus the administrative burden of a bunch of pieces of technology.
Got it. Thank you. So let me ask too, John, going back to, you mentioned the turnover in nursing and nursing staff. How can this kind of technology help reduce that turnover and make nurses feel safer?
Well, you heard me say earlier, the more tools we put in the tool belt, as I said, for military or for police officers, they have those tools. Nurses don't have the tools. And I think that's what we're looking for, are solutions to help mitigate the problem. As I said before, we expect physiologically ill patients to not necessarily behave, the correct way all the time. We can manage that. It's the others that we really need support for. So, I think it's just adding those tools to the tool belt.
So I know we're short on time here, so let me just ask, are there any questions I didn't ask that I should have, or what kind of big message would each of you like to leave with people today?
Yeah, from my perspective, I think I would just say that I hope that we're bringing national attention to this issue for nursing. As I flew in last night, I thought about the flight attendant on the plane and how protected they are from a federal level. And it worries me that we don't protect nurses who are already dealing with some of the most difficult times in a patient or family member's life. We should have the same kind of protections.
Thank you. And Mike, you?
Sure. Yeah, I'll just say, if you're interested in learning more about this, check out axon.com/healthcare. There's a number of great resources around this, as well as solutions that are being deployed every day to protect our nurses. And then I just want to say to John and his 4 million colleagues around the US, thank you for everything that you do.
Thank you both for being here today. We've been talking with John Voight. He's the Vice President and Chief Nursing Officer at Memorial Hermann The Woodlands Medical Center And he's a U.S. Army veteran. Thank you for your service, John. And he's a former law enforcement professional. He's a recognized leader in workplace violence prevention. And we've also been talking with Mike Shore, the Senior Vice President and General Manager of the Enterprise Division at Axon. And you hear what they're doing is providing technology in the workplace to make doctors and nurses feel safer. Thank you both for being with us today.
Thank
Thank
you.
you.
This has been Jonathan Marx. As we say at the end of every show, go to health. We'll see you again next time. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at GoToHealthMedia.com. See you next time, and remember to elevate your life with Go to Health.